Hello and welcome to the program. My name is Marie Yambo. Our social media handles at Marie Yambo, at KBC Channel 1 on X, KBC Channel 1 TV on Facebook. We are also on YouTube. Coming up in the program, Kenya records more Mpox cases.
We have upped our surveillance, we have upped our screening, and we pray that there is no transportation of the same that will get into our country.
And the Ministry of Health, PS Mary Muthoni, assures the country that all measures have been put in place to deal with any outbreaks of Mpox. And on Good Practice, we answer some of your questions on Mpox. So let's talk about Mpox and whether we should be worried. Since early this year, cases of Mpox, formerly called monkeypox, have been confirmed in the Democratic Republic of Congo. But now, 18 countries, including Kenya, have reported the disease. Kenya has so far reported 13 cases as of October the 14th, 2024. The disease has now spread far and beyond the African continent, with Sweden, Pakistan, and the Philippines recording 1 case each, and the numbers are likely to increase. Mpox is a zoonotic disease, meaning it can be passed from animals to humans. It was first identified in 1958 in lab monkeys in Denmark. But monkeys aren't the main carriers of the virus.
It's not only monkeys that are reservoirs of Mpox. There are many other animals, mostly wild animals. So it will find it in rodents, particularly the rats, sometimes in a few rabbits here and there. There are animals called hares. Especially very forested areas. The animals that are found in some of these forested areas are some of the reservoirs of this virus.
There are 2 strains of the virus: the Democratic Republic of Congo strain, which has a mortality rate of 11%, and the West African strain, which is less severe and has a mortality rate of 1%. Evidence, according to Africa Center for Disease Control and Prevention, that is CDC, suggests that the current outbreak is linked to the strain in the DR Congo.
Where the epicenter of where this specific variant is circulating, that's in certain areas of the DR Congo. Those are very crowded areas. In fact, some of them are, can I say, conflict zones. So they are very, very, very concentrated.
Although Mpox can be passed from animals to humans through handling or consuming an infected animal, what is happening this time round is that it's being driven largely by human-to-human transmission.
The mode of transmission that time was mostly discovered to be sexual. But now, over time, as the mutations kept going, there are other modes of transmission that are now being seen. So things like, skin-to-skin contact with someone who's been infected, close contact with droplets, behavior such as kissing, and then also in pregnancy, a woman who is infected can easily transmit through placental transmission to the unborn fetus. So it's now become a very multifaceted transmission cycle, and it's no longer the traditional animal to human that we thought about. So now there's but it's mostly close contact.
So how does Mpox spread between humans? Although Mpox can be sexually transmitted, you can also get it indirectly by sharing clothes, such as bed sheets or towels that have been contaminated. It can also be transmitted through respiratory droplets from an infected person's cough or sneezes. If you get it, some of the first symptoms will present like the flu, body aches, fever, coughs, and then some rash on the body that can form blisters. People with strong immunity recover from Mpox on their own in 2 to about 4 weeks, but it can also be serious for those with weak immunity or immunosuppressed people.
For others who may not have very intact immune systems, for example, children, or people who live with HIV with very depressed immune systems, or people on very heavy drugs that are used to treat them but keeping their immune system low, those are the people who might have a bit of issues with regards to clearance of the infection. So they might have lesions for much, much longer, even up to 3 to 4 weeks.
The World Health Organization declared Mpox a public health emergency of international concern. What that means is that countries around the world are expected to allocate resources and institute preventive measures with the help of the WHO to deal with any outbreaks.
Also allows countries that may have certain technologies that may help in preventing or in controlling to start thinking of ways of how this can be scaled up, especially to regions where Mpox has become a problem. So that may mean availing, diagnostics. That may entail availing potential medications, and then figuring out who may benefit from those medications, because there are not so many. So not everyone with Mpox will get those medicines. So they'll need to start coming up with tools on who might get this treatment. So algorithms may need to be built by the various ministries of health, and then potentially now also encouraging the manufacturing companies of these vaccines to now start ramping up production of these vaccines.
The Ministry of Health Principal Secretary for Public Health, Mary Muthoni, has warned that although the numbers being reported in the country are low, each person must take personal responsibility to protect themselves and their families. Keep in mind, there's still no known treatment for Mpox, but a vaccine developed to fight smallpox can be effective since Mpox is from the same family of viruses with smallpox. There are other methods of infection control that are similar to those deployed during COVID-19, like contact tracing, testing, and quarantine. So what to keep in mind is that Mpox is not just sexually transmitted, but you can also get it through close contact and sharing of clothing. So far, Kenya has recorded 13 cases as of the 14th of October 2024. And so we asked Kenyans what they know about Mpox. Let's listen in to Words on the Streets.
Nimesikia tu hata watu wanasema hii kitu inakaa kama corona bwana, lakini kwa media ndio nimesikia. Sasa tunashuku kitu kinakaa kama corona. Wakiona kitu yenye sio kawaida, you have to visit the hospital. Yeah. For proper check-up. Unless yenyewe pesa iko shida, lakini lazima uwe hospitali ipatikane kama hiyo shida ama ni nini.
Yeah, I've heard of Mpox. It is an airborne disease. You can get it through body contact. Mtu ambaye ako nayo ukimkaribia unaweza pata hiyo ugonjwa.
About the Mpox, I've heard it's come from Congo. Na tujui sasa vile imeingia hapa na measurements the health vile wanachukua, they've not even had anything. So ikianza kama corona, I think we'll be in trouble again. I myself currently know, but I do not even know anything about it. So I think I should do more even research myself. But even the government should do more research and give us the public announcements bana. Tuambie kila saa during programs, like the way they're doing for corona. At least they'll be telling us, updating what are the symptoms, how it comes, all that.
I know Mpox is a viral disease when a person when a person who has Mpox touches some surfaces and then another person touches, she gets infected.
Mpox nimesikia so far, but so far there's nobody I've come across that has really been affected by this disease. But the way according to the media, I've come to understand that it's a very deadly disease. Once it attacks someone, that person will be seriously bedridden, and the consequences thereafter, it is very dire. What the government has to do right now, it has to come out with a clear guideline on how to sensitize the masses on about the disease, because most of people, they don't know actually the really cause of the disease and what precautions they have to actually to take into account.
Clearly, still a lot of public awareness to be done to ensure people know how to protect themselves in as far as Mpox is concerned. On that note, we take a break, but I'll be back with much more, including an interview with the Principal Secretary for Public Health, Mary Muthoni. You do not want to miss it. Thank you for staying with us. We are now joined by the Principal Secretary for Public Health, that is Mary Mudhoni, and she'll be talking more about the Mpox cases in the country. But we'd also like to let you know that this interview was recorded earlier before the Mpox cases increased, and so the numbers may vary. Let's listen in. Thank you so much, Principal Secretary, for allowing us to come and talk to you and just, elaborate for us what is happening as far as the Mpox is concerned. WHO declared, Mpox public health, emergency. And that means that as member countries, Kenya included, there are measures that have to be put in place now. So probably you could tell us what measures have been put in place in terms of, can I say, health workers? Do we have isolation centers the way we used to have them during COVID? And probably even as you talk about that, you could touch on maybe counties, how your ministry is now working with the counties to ensure that we are, prepared.
So following to the notification of Mpox outbreak in DRC Congo and other neighboring countries, and subsequent confirmation of the one case in Kenya, the Ministry of Health, in collaboration with the county governments, have instituted relevant preparedness and response measures, which include, and not limited to, the strengthening of the coordination amongst the national government players and the county government players. Remember, the one case that was detected was actually in Taita Taveta. So what we did was to give support to the county to ensure that we have a lot of surveillance around there, increased screening of every passenger or every traveler who is coming into the country. So we have activated our Public Health Emergency Operations Center, and we have 25 others across the country. Then we have also enhanced our surveillance in the 47 counties and all points of entry. Last weekend alone, we were able to visit points of entry, ground points of entry, sea and air, just to check on the preparedness. Again, we have also strengthened the exit and entry points through temperature checks and ensuring that screening is done for each and every person. We are sensitizing the stakeholders around every entry point also to equally know the signs and symptoms, what they need to check for, what they need to do, the procedures and manuals that need to be followed at every entry point. So currently, as you may know, we do not have even vaccine for Mpox that is in the country. But the ministry has, however, initiated consultation with WHO and Africa CDC and other institutions with the view of accessing vaccines that have been approved by WHO for emergency use. So it's work ongoing, and everything is taken care of.
Okay. So those are some of the measures that the ministry has put in place and all that. But this is now at the ministry's level, at the county, can I say, level, or facility level for that matter. But is there a hotline or a number that Kenyans can call in case they suspect that someone or themselves could be having the symptoms of Mpox?
Currently, the testing of specimens from suspected cases of Mpox is conducted in the main laboratories. We have National Public Health Virology Laboratory, we have the CDC laboratories, we have KEMRI, and plans are underway to procure the relevant reagents for equipping some of these laboratories. Remember, we've talked about the coordination between ourselves and the county government. So we are working in tandem that should there be a suspected case, then we know where it should be taken. That is why we have activated the Public Health Emergency Operations Center to make sure that coordination is there and everything is moving on seamlessly. And yes, we have contacts that we can call. 719 is our hotline, and we also have the 0729 471 414. We have 0732 353535. So those are the calling lines that anybody, should you feel that you're uncomfortable or you want to get more information, it would be important that anybody calls in. Or you see somebody who probably needs help, it is important that you call us. Then we can coordinate from whichever part of the country then the specimen can be transported. Yeah.
And last but not least is what is happening in the community. So we've talked about what is happening at the facility levels and government and all that. But at the community level, is there anything happening? Because I know we have the community health promoters. I don't know whether they're engaged in any way. And even as you answer that question, probably you could also give your advice to Kenyans on what they should be doing at a personal level.
Our training for community health promoters is a continuous process and a continuous procedure. Every now and then we have training, and some of these issues are incorporated into the curriculum as we move forward. Therefore, at the community level, the Mpox messaging is ongoing on prevention. How do you prevent yourself from getting Mpox? Case detection, infection and prevention and control of the same. And of course, these messages have been developed in different medium of communication, through the media, print media, through digital awareness, and through forums. We are coordinating very well, even with the national administration. At the bottom of the pyramid, the Nyumba Kumi, the community health promoters, the chiefs, because those are the people who are closest to the communities, and they will be able to pass one message to the other.
What are some of the strategic communication being used, the guidelines? We know that we have opinion leaders in our communities, religious leaders, community leaders and all that. Is there a chance that you've already sensitized them on how to pass this information to the people?
We have started having a continuous sensitization with the stakeholders, and especially people who are working at points of entry. We are also calling upon religious leaders, and we shall continue sensitizing many other people, school teachers, on what they should tell the children, and equally our partners to come on board, because this is a collective effort. It cannot be done by just the Ministry of Health. It is for all of us, including the media. The kind of messages that you do is going to be very, very critical. So do not circulate that has not been confirmed, because you will create a lot of uneasiness amongst the public for merely nothing. Really, we have contained the country, and we are in a safe space right now. We have upped our surveillance, we have upped our screening, and we pray that there is no transportation of the same that will get into our country.
Thank you so much, Principal Secretary, for taking your time and just, explaining to us some of the measures that the government is putting in place, and especially the Ministry of Health, in as far as the Mpox is concerned. And like you said, heightened surveillance. People should take personal responsibility in as much as we do not have very many number of cases yet in the country. So, asante sana, and we hope to get more updates. That has been the Principal Secretary in the Ministry of Health, that is Public Health Principal Secretary Mary Muthoni, and she's already explained to you some of the symptoms of Mpox, what you need to do at an individual level. The thing is not to panic, but to be concerned, because the countries around us have Mpox. So that doesn't mean that we sit back and wait for it to get to us. So she's already also explained some of the steps you need to take to ensure that you keep safe in your own communities. Indeed, personal responsibility is the key to ensuring that you do not contract Mpox. And so on Good Practice today, we look at the do's and don'ts in as far as Mpox is concerned. So do contact your healthcare provider for advice in case you suspect you have Mpox. Well, if you have Mpox, you need to isolate in a well-ventilated room if possible. Again, wash your hands often with soap and water or hand sanitizer before or after touching sores. Wear a mask and cover lesions when around other people until your rash heals. Keep skin dry and uncovered unless in a room with someone else, and avoid touching items in shared spaces, and disinfect shared spaces frequently. Use salty water rinses for sores in the mouth, and take warm baths with baking soda or Epsom salts for body sores, and take over-the-counter medication in case you have to deal with pain. And lastly, remember to practice safe sex, because as we know it, Mpox is sexually transmitted. Now let's look at the don'ts. Do not pop blisters or scratch sores, which can slow healing, spread the rash to other parts of the body, and also do not shave areas with sores until scabs have healed. We've come to the end of the program. On behalf of all who made this program possible, the Public Health Principal Secretary Mary Muthoni, Dr. Paul Yonga, for the insightful information on Mpox, we are grateful for your time. Remember, this program is also available on YouTube in case you missed any part of the program. My name is Maria and hope to see you again next time.